Um, we'll have this available likely online by Friday, but feel free to reach out at any time if there's any of the resources that we talk about that you just have to get your hands on right away. But we do try and make those available by Friday for you. So I'm passing it over to Tom for a quick moment in case there's any organizational updates that you'd like to make folks aware of.
Well, hey, Jan, and I'm sure you'll probably touch on this or at least mention it as well. But of course, the Seattle conference coming up in April. We hope to see you all there. And it's always worth reminding you about the Family Navigator. There's always new reasons to contact Heather and her team and Susan and the affiliate network, which is getting close to, I think, 45 members. So it's all very important. The advocacy is so critical. You can't turn away because you don't know when there's going to be an opportunity. And Jen and Susan Carlson and the team know this so very well as we look back at the ups and downs. Of course, we're going to get this done, but it can be maddening. Speaking for myself and just the feelings that are evoked in trying to do something so critical to all of us. So thank you as advocates for all the great work that you're doing at every level, parents and family members and leaders in your communities, states, and nationally on this issue. So, and thanks, Jen, for keeping us all on track and telling us what to do and how we can help.
Well, I'm glad that my internal bossiness is helping out from a policy perspective.
If I may, really quick, Jen, a quick shout out to Heather and the Navigator team. I had a family from the UK found my lunch and learn this week and asked if I knew anybody in the United Kingdom that could help them. And I sent a request, and sure enough, we were able to connect them with some people. So that is phenomenal. I did not expect that, but yeah, we hooked them up. So thank you to the Navigator team for that.
Excellent. I love to hear things like that, and I am not surprised. Our Navigator team really is phenomenal. And so for those of you that might not know, our Navigator is free of charge, obviously, very low barrier. You can contact email, phone, or through a form on the online. And our navigators are available to help from 9 a.m. to 10 p.m. Eastern, Monday through Friday. So we should have coast to coast coverage, including Alaska and Hawaii, for anybody that needs to reach out and get information, resources, and peer support. All of our navigators are either family members of people with FASD or a person with FASD. Yeah, definitely. If you have questions, if you need information, if you need suggestions on where to look for resources, they would be my first hit there. So thanks, Carl. I appreciate you sharing that. Just an update. If you're reaching out to us, the old address you have saved is no longer valid. We are in a new home after a considerable amount of time and that is much more accessible. So make a note of the address. It's also at the bottom of our website if you need to find it. We've tried to make sure we've updated everything we have with that, but just be on the lookout for the new address. Still in Georgetown, just a lot more accessible, which is exciting. Tom mentioned the research conference. Registration is still open for that. People are still registering. We've had some pretty big registration weeks here recently. Really looking forward to seeing you all there. Of note, the agenda for the pre-conference for the session on FASD and the law is really shaping up to be a very good one. And highly recommend that if you're able to attend, please do so. I dearly wish we could do that as a hybrid piece, but it's just not feasible. One of the hardest things to do is actually coordinate a hybrid conference. And with this being our first one, taking guardianship of this conference, it definitely has to be an in-person thing. But If you go to our website and look at the agenda, we have speakers from all over the world coming in for this. And I think it's shaping up to be a really good information sharing, knowledge sharing, collaborative environment for folks. So excited to see you all there. Moving on to the FASD Respect Act, the main event, obviously, the bill that was introduced at the beginning of the 118th Congress to bring support to people with FASD, families, caregivers, and to insert FASD-informed care into existing infrastructure in states, and funding to states to be able to add FASD to the mix, give FASD a seat at the table. So working on that, we are still sitting on the floor. We're on the general calendar, which means that the bill will not be picked up until the speaker decides, hey, this is what we're putting on the agenda. So we've talked about this a bit before, the 118th Congress. So each Congress lasts a total of 2 years. The 118th started in 2023. It will end in December of 2024. So we have 2 years from start to finish to get a bill passed. And if you don't pass in that time frame, then you start over again. So we are in year 2. We did get some news this last week that is good news, but it definitely kind of changes how we may need to approach things. So lame duck. A lame duck is when the period after an election and before the next legislative session starts. So we have an election coming up in 2020. We know that there may be changes to the House, the Senate, and the presidency. And in that period afterwards is, from our understanding and the research or the information we've been given by the bill sponsors, is likely when the Support Reauthorization Act, which the FASD Respect Act is now bundled into, will be heard. So good news and bad news in that. The Support Reauthorization Act, which again our bill is bundled into, is considered a must-pass bill. There are a lot of folks that are very, from all different sectors, that are very interested and invested in getting that bill passed. There's some core funding that needs to be approved through that bill. It's a great vehicle bill to be on. And why it's going into a lame duck, and Susan, please fill in if I'm missing anything here, is that prior to an election, neither party can give each other a win, right? So if you're running on being a fiscal conservative, right, you can't pass a big package bill and see a win. If you're running on providing services and support, the other party doesn't want to give you a win there. So it would be a lot easier to do legislation if politics wasn't involved, but that's why they call it politics, right? So that's where we are. So after the lame duck, or during the lame duck period, it's, passing things becomes a lot easier because then people aren't worried about being reelected, right? So that's the intel we have so far from one of the lead authors' offices. And Susan, do you have anything else you want to say on that piece?
No, I think you did a good job. And I guess it's good to know that, because then you can have a game plan. And we heard this on the Senate side, and it came from Leader Schumer, that this is what there's going to be a lot of bills, and not just the Support Reauthorization Act, but as you all know, there was a big meeting at the White House yesterday on the funding bills. And so my question was, does that make a difference? What, any, them coming up with an agreement on the funding bills or continuing resolution, and the answer was no, that, you know, there's not gonna be a lot of legislating done, which that's what they're gonna have to make decisions on what, because there's a difference, as we all know, between the House version and the Senate version. The Senate version has the Respect Act and it has other provisions that the House doesn't, and vice versa. So they're not gonna be doing a lot of legislating. So, and I think, like Jen said, it is good news and bad news. I mean, the bad news is we want to get it done, right? You know, we want to get it done now, so, but I think the good news is, there, and we don't know what the schedule is going to be for FY appropriations 2025. The bill that we had, the Respect Act language is authorization language, and it says such sums. So we need to, and I asked this on the Senate authors, should we be really focusing on making our case on the appropriations during this time? And they said, yes, that's great strategy. So that's what we're going to be doing. Jen and I are going to be going to DC in a couple of weeks. It still may be crazy time. I mean, you just never know what's going to be going on. There may not be a continuing resolution there, and there may be. But I think, and we've talked about it, this gives all of you the opportunity to get, if we haven't gotten your co-sponsors on the bill, now is the time. You've got this time, and it's an election year, so they're going to want to do something good for you. So now is the time to get those co-sponsors, because the more we have, the more likelihood the House will agree to do it and to do the appropriation that we would like. So that's the latest and greatest on that.
Well, and I think the good news and what I see is different from November, December of 2022 is that we are in a big package must-pass bill. This is not a Hail Mary hotline version of the bill. We've already passed through the Senate help. So I think we're in a much better position. For me, it's a little frustrating because it's a waiting game, right? But there's things we can do in the interim that are definitely going to be insurance against you know, any concerns that we might have as things get really busy and get passed through once they're into that lame duck period. So any questions on any of that? Okay. Oh, Lex, you have a question.
Yeah, thank you so much. So I have a question that's actually related to Carl's question in the chat. So 2 of our 3 House Republicans in Colorado are not rerunning for election. And so I'm just curious what the strategy is, or if the strategy shifts, if we're advocating and reaching out to, you know, legislators who, you know, it's just the strategy is different. They're not looking for reelection. So I guess I'm just curious, what is the strategy? And then a second question, which you might be going into, so feel free to hold on this, but what advocacy do you need around appropriations?
Great questions. Really appreciate you bringing those up. And absolutely, that does lend into exactly what we're going to talk about next. And Carl, I thought you had your hand up, but I could be wrong.
You did.
Okay.
I can explain what I'm doing in North Dakota in regards to our congressman not running for re-election. Briefly, if that's okay.
Please. Sure.
We are approaching the candidates that are running for his seat in the hopes that whichever one wins will eventually decide to sponsor, even if we have to start over again in January. So it's frustrating, but it is what it is. But yes, unfortunately, that's the only move I can make in regards to the House seat. I wish it was a different answer. So,
well, and I would say that they have nothing to lose, right?
They don't. No,
by
don't.
signing on, you know. I mean, there's no politics involved for
See,
them.
in our case, Congressman Armstrong claims to be a big proponent of disabilities and mental health, but yet he's hesitant to sign on to anything supporting those two things. And now he's running for governor. So, yeah, I don't know. I don't pretend to understand the way they think.
Well, I mean, the good news too, though, is the advocacy work that you do now could pay off during the lame duck. They might not sign on as a co-sponsor in this period, but they might sign on during the lame duck. And that's honestly when we're going to need them most, right?
Yeah.
So I think that's the strategy, is to keep pushing in that direction. I know I sound like a broken record, and I know, you know, we've been doing this for 3 years now. We're tired. We've been doing it, right? But every no gets us one step closer to a yes. Every piece of activity builds on the next piece of activity. And, you know, we're not going to accomplish what we want to accomplish by stopping. You know, you don't move forward if you stop walking. And that's really where we're at. We're tired. I get it. We need to keep moving forward, or we lose all that momentum that we had from before. So Kathy, you had your hand up?
Yes, we had a senator say in response to asking him to co-sponsor that he made sure it went through the help committee. And I guess then he thought his job was done. Shouldn't we go back and ask him that, say that's great, but we would like you to still co-sponsor?
Mm-hmm.
Okay.
I think that's a valid request. You know, in doing so, you're showing others that you do support it above and beyond. And I don't think there's any harm in that. You're showing that you're tied to the issue, and the issue is important enough to co-sponsor. And it's not a
Okay.
lot of work to co-sponsor, to be honest.
Right.
You know,
Okay.
they need to,
Thanks.
yeah. So, okay. Great. So, yeah, here's what we do to continue. We kind of worked on that, but yeah, we are asking for co-sponsors for the FASD Respect Act, not the Support Reauthorization Act, although that time may come. The other thing that is really helpful to do right now is endorsements. If you have a state disabilities council, if you have organizations active in your state, corporations, companies, anybody you can that is active in your state in the world of disability, this is a great opportunity to go after those endorsements. Online, there's an endorsement form. It takes about a minute to fill out. Organizations are used to being approached for endorsements. If you go online on the policy site, there's a list of all the endorsements by state so far and the national endorsements. So if you can focus on state endorsements, or if you have connectivity to national endorsements, that's another great thing to do. The more we can show support for this bill, the more we are hedging our bets. You know, we've got our insurance against being kicked out of the Support Reauthorization Act. I don't think that's a huge concern, but I like insurance. I want to be really sure. I don't want to have to have gone through the last 2 years and not have that insurance in place. The other piece is to really be active in your state. You know, when the Respect Act passes, we're going to need to have states really activated and working in FASD in order to take full advantage of this bill. So now is the time to be building the plans, to be making the connections, you know, connecting with state agencies and getting them ready for this bill to come into place. Looking at February, what happened in February, we had only 2 meetings in February, one with the great state of Massachusetts and one in Texas, and no new co-sponsors. So you can see how our meetings have really kind of dropped down. You know, we've gone from having, you know, 15, 20 a month to like 2. So if you have the bandwidth and the opportunity, really recommend setting up those meetings. If we've already met with them, hey, cool, meet with them again. We can do that, right? Give them some more information. We want to give you an update on where we're at. We want to give you an update on some new information that's come out about FASD. You know, we can find reasons to meet with them, but it's a good idea to reconnect, not just for the sake of meeting with them, but for building those relationships. You want them to remember FASD after the, and this goes along with appropriations, right? We may want to talk to them about the appropriations piece too, depending on which legislator they are. And we're going to reach out to a number of you where you have appropriators in your state that may be helpful to this particular cause. Yeah, it's keeping it going. We've got some decent coverage on the map here, but and I think we can color in Kansas now. I just noticed that with one sponsor, one sponsor, one meeting. That is right, actually. But just looking at the coverage, who'd have thought, 3 years ago that we would be covering this many states with advocacy? And this is kind of cool, right? This wasn't something that I think we had before. Looking at our House meetings, again, who'd have thought that we would have had this much coverage 3 years ago? So last month, we rolled out some new resources. One was a piece of sample legislation, and one was a template for an executive order for creating the state's FASD advisory committee. And a number of you reached out for more information on that. Just by a show of hands, who all is using those templates right now in their states, or is looking at using those templates in their states? I see Colorado, I see North Dakota, I see Kansas, I see New York. So this is great. That's
Yes, North
Oh,
Carolina. I
North
can't
Carolina.
find my hand.
I have that problem sometimes too, Kathy. I see Massachusetts, I see Arkansas. So excellent. These are some, exactly what we had wanted to have done with these tools. So what we're going to do in future policy meetings is just check in with you and see how that's going. See where you're at with that. Give some space and some time for questions. Give some space and some time for learning from each other in what's working, what's not working in setting up that state approach. So in terms of guidance, and this is a repeat from last month, but I really want to just reiterate these things very quickly. This is not a solo, this is a symphony. So start building your band. Maybe you start out as a duet, then you turn into a trio before you get to your symphony, but you need to involve other people in your state. And start now. That's the big one. It is not too early to get started on this. And that's a key takeaway from here. These are the states that we've noted so far, and we need to add New York to the mix there. So we will definitely do that. Chris, if you can make a note, Teresa Comboy put her hand up. But these are the states that we've noted so far that are working on state level policy, and whether they're using the templates or not. And on our website, we have a listing of who is working on particular policy, so that way, if people contact us and say, hey, I'm really excited about doing something in Texas, and I want to get this legislation passed in Texas, we can connect them with the other people in Texas who are working on legislation and help build coalitions, as opposed to having, well, I'm working on this over here, I'm working on that over there. You might be working at cross purposes. There's strengths in numbers. So passing that along. I know, and this was something that we had kind of wanted to talk about in the forum, and we didn't get a slide up for it, unfortunately, but I know Carl had shared this the other day, and Joel's sharing it in the chat too, that there was a paper published by Phil May on prevalence, and looking at a 1 in 14 prevalence as opposed to a 1 in 20 prevalence. And Dr. May all along has said that the numbers of their study are conservative. Those are conservative numbers, right? And this study, and please correct me if I'm wrong, Tom, Susan, this paper that he published took a portion of that cohort that they did the active case ascertainment on. And in that portion that they took, it came up with a 1 in 14 prevalence. So because it's not the big major study, we are waiting a little bit to kind of see what else is published and see where else this goes before we really start embracing that 1 in 14 number, because it's strong, it's valid science, but it's not as strong as that 1 in 20 study that came out. And if we're, so I'm not saying the number is wrong. I'm not contradicting Dr. May in any way, shape, or form. I'm just saying let's use some caution as we roll that out, because we may need more backup with that than we would need with the 1 in 20.
Yeah,
that-
and I did share, and I don't see any reason why you all couldn't share that with your members of Congress. I did share it with Senator Klobuchar's staff, and I said, oh, here's some good nighttime reading, and she said, this is helpful, but an unfortunate number, you know. So I think that gives you another opportunity to make contact with your you know, your staff, so they can see that, you know, this isn't getting better, and this is there was this cohort, and Jen's absolutely right. We had several meetings where Dr. May was there and would say, and it was specific to this group that was in the study, this is, you know, this is a conservative number. So
Yeah, and this was after he published that paper
yeah,
with the 1 in 14. He was still using the 1 in 20 number. So that's
Yeah.
where I'm like, I'm not saying don't use it. I'm saying go ahead, send that information to your legislators. But just be aware that the 1 in 20 is probably still going to be with us for a while, because that was the more robust study.
I talked to Dr. Larry Bird about those numbers yesterday, and he said the 1 in 20 number is based on clinical observations and not population-based study. And he said given the choice, he would use the higher number, meaning the 1 in 14. Because he said it's more accurate. And then he also commented that the Dr. Hayes, I think that's his name, said in that study that he wrote the paper on, that he compared the cohort they did on our study, is that with other cohorts that were similar in other parts of the country that were studied, and the mean is close enough to say that 1 in 14 is a fairly accurate number. So just for what it's worth, but
it's totally accurate.
It's
just
something to share, but we need to,
we need to give the context around it too.
Yeah.
And that's, I think what I'm getting at is, let's give the context, because if we come out and we're saying 1 in 14 and the CDC site is still saying 1 in 20, and we're still battling some of the other very reputable health education sites that actually list the old prevalence number prior to that, you know, we just need to make sure that we're messaging this in a way that is verifiable. So send the paper with it, right? Yeah. So Joel, you had your hand up, and then Ruben.
Well, you just mentioned it there at the end, but that's what my approach is, to stick to the 1 in 20, but in conversation, that there are pockets and research and clinical evidence that the numbers are going up, and here's the reference. Just like South Africa, that I use in a conversation, but the numbers have pockets that are 25%. And it's Dr. May's research that shows that. So you can forward that. This is a global problem. Here in the US, it's 1 in 20, but research is now showing it's 1 in 14. It's a big issue. And you can also position the CDC's 1 in 7 women admit to drinking during pregnancy. So the impact is 14%.
And
just impact. Not everybody has a behavior issue, but alcohol affects sleep, your sensory issues, your organization, your ADHD. So those are verbal conversations, but anyway, those are just some firepower to follow back up with people. This is a serious and critical issue that needs to be addressed. The longer you wait on budget, the less there's support.
Here, here. Agreed. Ruben,
Hello. I guess I just wanted a little clarification. So, in terms of speaking with legislators, I feel pretty confident with what was just said. What Joel just said was really helpful. For those of us who do trainings, which I know there's a good amount in here as well, a huge portion of a majority of the trainings that I've set up recently and for the future have that, prevalence diagnostic need stuff within it. Would you say, and it might not be a one, black and white answer, but for those trainings, sticking with that 1 in 20, that original MACE study that I use, is that what not the expectation, but what I should continue to do for now, and then maybe throw in some information about those other numbers, or just leave it as is for the time being?
I think similar to with legislators, and we're not here in a position to be telling you what to do or
Yeah.
what information you're allowed or not allowed to use. That's not our role, right?
Right.
But I think understanding the nuance of the conversation and the direction things are going in is helpful. So while I might have the 1 in 20 up on screen, I might talk about how, although additional papers have been published that show rates as high as 1 in 14, and talking about those differences just verbally, right?
Yeah.
For the time
Okay.
being, that's
And, yeah.
if I were handling it, that's how I would do it. But again,
That's the way I'm handling it, Jen, is having it as a conversation piece, but still keeping the 1 in 20 numbers, because that's what the CDC has on their website. And people are going to look to those more scientific sites from the federal government, like CDC and NIAAA, before they'll take my word over it. Study or no study.
Thank you.
thanks, Ruben. Kathy, you had your hand up.
I think we can claim this number a little more readily in North Carolina, since the county he's talking about in the southeastern part of the United States, even though he won't say the southeastern part of the United States is North Carolina, we all know it is.
I would say, yeah, that's probably fairly accurate.
I would claim it, Kath.
Thank you, Susan. We're claiming it. It's going out as I speak.
I didn't know you were drinking more than Minnesota though, so.
All right.
Not more than Ireland.
North Dakota's got you both beat for population.
Great conversation though. Thank you all for that. I want to pivot slightly. Now is the time of year where most people start thinking about spring and planting their gardens, and part of planting and preparing for the future is getting ready for issuing state proclamations for FASD Awareness Month or FASD Awareness Day. So Chris, can I have you kind of talk about this, the project that you are working on with the support of Liv, our intern?
Yeah, absolutely. Thank you very much. And this is a project that I'm really excited to get started for a few reasons. The primary reason being that it's a chance for us at FAC United to work closely with all of you, all the amazing advocates spread out across the country, that I think will make our goal or challenge of getting requests in for state proclamations to all 50 states possible. Again, I think with all the work you've already done and everything like that, I think it's quite possible for us to have state proclamations submitted across the country well in advance of September. So one of the things that we've done here as part of this project is go ahead and compile all of the processes and requirements necessary for each different state to get these proclamations. And for anyone who isn't aware, ceremonial proclamations are given out by governors, usually at the request of constituents, people within the states. While they're not legally binding, they do influence public policy discussions and serve to raise awareness. having proclamations from governors from each state, as well as cities, and I'm going to try to get one here in the district as well, would send a clear message to the federal government that FASD needs, deserves, requires to be part of more conversations and to be given a seat at the table. I'm sure many of you, I've seen this in the research I've been doing, have submitted proclamations in the past and won't need any help from us. But if you haven't done this before, or even if you have and you just want a little bit of support, we're here to help in any way that we possibly can. As I said, we've compiled the requirements and steps, all the different forms and contact information for submitting proclamation requests in all 50 states. We also have within this document the earliest possible date of submission and the last possible date of submission. So in my calendar, I have it set up so I know that as soon as it's six weeks prior to the date of submission in, say, Michigan, I can get in there and make sure that either we're getting that submitted or one of our grid advocates out in Michigan is getting that submitted. That's just one example. We've also developed draft language you can use. We have a few examples just in case you don't want to go through the process of drafting your own language. We have templates available on the website that's listed on this slide here. A lot of the states have different requirements. Some will require 4 to 6 whereas statements followed by a therefore. Some of the processes can be a little confusing. Again, that's why we're here to help. You can give me an email, give me a call, and I'll send you over the exact process, the exact requirements, and everything like that. Again, we're here to help in any way we can with this. We know that you're all more than capable of doing this, and most of you have done this before. We really just want to streamline it. At the very least, we'd love to just be kept in the loop regarding your proclamation efforts this year. If you want to lead the way in your state, or if you want any sort of help, again, give me a call, give me an email, and I can send over all the information we have, can walk you through the process in your state, and I can let you know other ways that we can help.
Well, thank you, Chris. And you know how we were talking earlier about how, this is not a solo job. This is a job for a symphony, right? Sometimes the state proclamations are a great way to engage other people in getting involved, because they can be a little bit tricky, but they're not horribly complex. That is not a huge ask of someone to put together the state proclamation if there's a template available, if there's instructions available, if there's support available. So as you're building your symphony and you're filling out your woodwind section, or whatever part of the symphony you're filling out, if there's people that are maybe a little bit newer to policy advocacy, this is a great task to involve them with. This is a great way to bring them in and kind of get their feet wet with working on policy and advocacy. So I highly encourage you to connect them with Chris. Talk about this within your own groups. Some of you in your states, you are the only one. Right now you are singing solo and you're singing a cappella. And I get that. And that's where, Chris can definitely help out, and having this information pre-prep for you can definitely help out. But again, this is a great job for somebody that you're trying to get engaged with policy, rather than taking it on yourself, if that's at all possible. And I recognize, again, in a lot of states, it's not going to be. So, but we're working on that, right? Thank you, Chris. Another project we have going, we have partners through the Department of Defense working on developing FASD clinical guidelines and diagnostic clinics in the military healthcare system. And it's a really exciting project. But when you're bringing people up to speed with FASD, figuring out how to talk about it, because it's super nuanced. There are layers of stigma everywhere. You could trip over those so easily. So part of that work that we're doing was to develop a stigma and language guide specific to the US. There are some great, absolutely fantastic language guides. The one out of Canada is phenomenal. I might be a little bit biased, but if you know, you know. But part of our work there was to develop a language and stigma guide for that purpose. But because FASD does not have enough funding to have, in general, one thing just equal one thing, the stigma and language guide is also being developed so that it can be used outside of that military healthcare situation. So I know Chris is going to talk a little bit more about it, but again, this is not FASD United telling you how you have to talk about things. This is us giving some suggestions, some researched ideas on how you can talk about things. And Chris has been doing a lot of the work on this. So I'll let him talk about it a little bit more.
Thanks, Jen. Yeah, as Jen just said, we're in the final stages of developing a language and stigma guide that's meant to act as a tool for anyone communicating about FASD or PAE. Central to this guide is the belief that language can be a powerful tool and something that can be used to reduce stigma and create FASD-informed systems of care. We hope this is done in this guide through the use of inclusive language, a focus on strengths and access to supports, and knowledge that relies on research and living experience. We have this guide broken down into a few different sections that cover preferred language, use of stigmatizing imagery, and conversation starters. Within the preferred language section, we're going to offer some standardized definitions of terms related to FASD and health equity. We also offer language focused on individuals with FASD, their parents and caregivers, and then ways to discuss research, statistics, and topics that should be mindful about. That last conversation we had before the state proclamations on the 1 in 20 statistic versus the 1 in 14 statistic, I think was a great example of a topic to be mindful about, right? So if you're going to come out with any statistics, and this is something we cover in the guide, make sure you have the reference there to back it up. We want to be truthful in order to be effectual, essentially. Jen also mentioned this. The suggestions we offer are just suggestions. We hope the guide will help you evaluate the language you use, but it's not meant to be prescriptive. The preference of individuals with FASD, their caregivers and families, and those who consume alcohol during pregnancy should always be considered. And finally, our understanding of stigma and this guide will evolve together, evaluating the way we use our language and how we communicate about FASD. And talking about stigma is just one way that we can ensure that FASD will have a seat at the table. Here on this slide, we just have a quick example of taken from the definitions section. One showing a term related to health equity and mental health in general, neurodiversity, and the other one that's a little bit more specific to the field of FASD, of course. Jen, did you want to add anything before I ask Sid what he would like to ask?
No, I think you've done a great job of explaining it, and really appreciate the work that's been put into this so far. But yeah, I did notice Sid had his hand up.
I'm really glad to get an update on this. We've found it's helpful to distinguish between different types and targets of stigma. There's a stigma that can be aimed very inappropriately at pregnant persons. There's a very different kind of stigma that affects children and adults with a diagnosis, and the system begins to treat them as disabled with very negative connotations. The one we often leave out, though, is maybe it's not stigma, maybe it's accountability, the role of health providers. The American College of Obstetrics and Gynecology recommends that validated screening tools should be used universally as part of prenatal care. The vast majority of providers do not do that. They may ask the question once, they may make a referral, but the follow-up surveys and individual conversations have made clear is absent. Again, I don't know if we should direct stigma at health providers who aren't doing what their national organization suggests would be good practice, but we ought to be holding them accountable and asking state associations of health providers who provide prenatal care, as well as the managed care and state agencies that provide the funding for prenatal care, why that's left out if that's a recommendation at the national level. So it's another kind of accountability. Stigma is the reverse side of accountability and can be inappropriate, or in some cases can increase accountability for better results.
I think that's such a valid statement, Sid. I really, I hear what you're saying there, and what we're looking for as a field is universal screening, right? Asking those questions universally. And I think, the guide does talk about some of the reasons why those questions may not be asked, but I think that's also in our work, giving the message about universal screening. And for those of you that don't know, universal screening is literally just that, asking those questions of every person, not just the people with a substance use disorder or an alcohol use disorder, or who are pregnant or who are looking to become pregnant, but really screening universally for alcohol use. And then specific to pregnancy and the questions that ACOG recommends, the American College of Obstetricians and Gynecologists, asking those specific questions, because there are some really great guidelines out there in terms of screening. Are they going to be effective 100% of the time? No, but universal screening is going to be far more effective than just targeting certain people, or people that medical professionals feel might be more at risk. So just making that part of our day-to-day conversation. Such a great point, Sid. Thank you for that. Any other questions or thoughts on this? I see in the chat how to screen the birth fathers when the women are the ones for the appointment. And that's where, universal means universal, right? We need to be asking questions about alcohol use in a non-stigmatizing way across the board.
There's some pretty good recent research on the impact fathers have, epigenetic and socializing, treating alcohol as a social norm, that we ought to be waving at people.
Absolutely. And FASD Services Mass Fast. I know it's not Ruben, so it's got to be Kristen. You got your hand up?
I do, thank you. I'm in my car. It's a statement on what Sid said, but here in Massachusetts, I was just asked to be a part of a meeting about the plan of safe care, which is something that I know is used across the country. And in Massachusetts, they're revamping.
I'm sorry, Kristen, I think you're cutting out. And as a nurse, I'd be very interested to hear your comments.
Still need to recreate the wheel. And, so that was my comment on it, is why?
And Kristen, I'm sorry, we lost quite a bit of what you were saying. So I'm hoping what you were saying was you were talking to them about the not needing to reinvent the wheel because the questions are already there and validated.
Yes, they're starting this in a committee, and I want to pull my hair out because I'm like, there are several we could use. And, yeah, I'm sorry if you can't catch on to what I'm saying.
Yeah, we hear you now. You just cut out for a little bit right in the middle of, I'm sure, like right in the middle of what you were talking about. So I was paraphrasing what I hope you were saying, or I think you were saying.
We have some training and technical assistance materials on our website at Children and Family Futures that the Children's Bureau and SAMHSA, who fund our organization, have asked us to pull together. And we're working in 9 sites across the country, 8 states and Orange County, California, on plans of safe care. It's actually one of 8 or 9 indicators that are now available in most states that I think we should probably be asking about on a regular basis. We might want to share some materials as to what those indicators are. Medicaid ICD codes For example, the plans of safe care. We've been able to get data from some hospitals on the numbers of people, of pregnant persons and infants, newborns that they have reported to child welfare, and those that they've detected but not reported. ACEs, some of the states have the PRAM system. Again, 8 or 9 different indicators being collected unevenly, to be sure, at the state level, and sometimes broken down to the county level. But we should be asking questions every chance we have to engage with state agencies about the indicators that are already out there in many cases, to get a sense of how our state compares, to know that California is one of the lowest ranking, for example, states in the country on children eligible for developmental disabilities services in terms of referrals that are made. That's very helpful in conversations with the state agencies responsible for IDEA. So I think we may want to share information as we can pull it out of the states where that data is available.
Well, and Sid, we have we spent a good portion, and by we I mean Heather French and her team, have spent quite a while compiling as much of that information as we can find on a state by state level that we are getting ready to push out and validate with people in those states doing the work prior to putting it out as a state data sheet, so that we have those apples to apples comparisons state by state when it comes to plans of safe care, PRAMs, qualifying for DD, IDEA, and some other factors at play. We were originally calling them state report cards, kind of that format. And we're hoping to have that data validated and ready to go here in the not so distant future. So we'll definitely connect with you about the data that we do have, and in particularly anything on California, do that in partnership and in tandem with the work that's being done in the state.
Great, thank you.
Welcome. Great questions. Policy is not just the FASD Respect Act. It's important and it's a big piece of it, and it's something that we're really we can't forget about in the other work that we're doing, because it's going to help build that puzzle and build that foundation for other things that we want to do. But I'm loving all the other thoughts and considerations and conversations that are happening around policy. It's very multifaceted. So thank you all for joining us. And if there are other questions, happy to stay on and chat about them and share ideas and information. Look forward to participating in meetings with a number of you, I'm sure, in the not too distant future, working on gaining co-sponsors for the FASD Respect Act. Susan and I are going to be in DC the 11th through the 15th. And so if you have any constituents in your area that would like to have a letter from them delivered directly to the legislator's office, feel free to get those together and send them over to Chris in the DC office, and Susan and I and Chris will hand deliver them on the Hill. Again, every little touch point we can have with legislators connecting their district to the issue would be great. We are participating on the 12th in a disability and general disabilities event on the Hill, where we'll be networking with various congressional offices, with a bunch of other disability organizations on the Hill to talk about issues in general for disability, but making sure that FASD is there and FASD is present along with the other disabilities. And that's part of our giving FASD a seat at the table, not just moving in the FASD space, moving in the general disability space too. So I'm quite excited about that. If there's anybody in DC that week who would like to participate, join us. let us know anytime you're in DC. I know Chris is always happy to escort people up to the Hill and get you resources or other information that might be helpful in doing some advocacy work there. So next meeting is last Wednesday of March. Look forward to seeing you all then. And until then, thank you for the great work you're doing in your states.